think having that sense of connection to what is it that I actually want to become, in spite of everything that's happening and some of those identity pulls and drives and a sense of invisibility, what is it that I actually want to be and what do I want to become and what are the pathways that I can take to achieve that outcome? And so it was always back to the books for me. So I really love learning. So that transition again, it was really great. Again, that journey of learning about different perspectives around how our societies are organized was really instructive.
There are many stories out there of strength, resilience, and courage, and we are on a mission to bring them all to you. Welcome to Empowered Voices Amplified, a podcast brought to you by Skilled Migrant Professionals magazine.
Our guest today, Associate Professor Kudzai, is a multiple award-winning infectious diseases specialist and has received national recognition for her contribution to health equity initiatives. She has a particular interest in technical solutions to health problems from her experience of health innovation in her birth country of Zimbabwe and working in rural and regional Australia. As Dean of the Royal Australasian College of Physicians, she is the organisation's chief medical voice, supporting the professional journeys of over 30,000 medical specialists across Australia and New Zealand. A vocal advocate for gender equity in STEM, her career journey encompasses technology, media, health, education and business. Testament to her commitment to community well-being, Associate Professor Kanhutu continues to provide patient care in the hospital and refugee health sector and further advancing migrant social inclusion through membership of the Australian Multicultural Council. Welcome.
Thank you for having me.
It is so good to have you, and thank you for making the time to talk to us. I am such a fangirl. I have watched your interviews on TV. I followed your journey closely and really love everything that you do and the voice that you bring to certain topics that are not really widely discussed. Sandra has just given us a rundown of some of the work that you do, but I'd really love for you to share with our guests a little bit about your story.
Sure. Where to begin? So I can work from forwards or backwards. Sometimes it's easy to work backwards and come forward into the future as a way of hope and inspiration, and also thinking through how we all can make decisions for ourselves that maybe change our trajectories. So in the introduction, you would have heard there that I'm a Zimbabwean Australian. I was born in Zimbabwe in the 1970s and migrated to Australia in 1985. I came here as part of our migration journey. Is one of my mother was coming here to study. She was in a relationship with an Australian at the time. And it was that classical Zimbabwean always looking for ways to learn and grow, and education being that the central pillar of how my family, and certainly that cultural disposition to being one oriented towards education as a means of growth and also transformation of families and place. So I arrived in Melbourne first and went to primary school here. And at that point in time, Australia was not as multicultural as we see it now. So we were the only African family at the school, probably the only African family in the suburb. So it was at that stage where if you were on the street and you saw someone who looked vaguely African, you'd be like, hello, who are you? Who's your family? Oh, you're Nigerian. That's not far from Zimbabwe. That's really close, in fact. We have moved, and the African parties of that period were epic because you get people from everywhere, because it was just that trying to seek a sense of place. And I think Australia still is on that journey of understanding the place of Africans within Australia and that sense of belonging that we all should be able to enjoy, while at the same time acknowledging our colonial connections. And the reason why we're here, for the most part, for English-speaking Zimbabweans, is that we have a shared colonial history, and we also need to acknowledge the impact that has had for our First Nations people in this country, and how we can respectfully acknowledge that and I guess be grateful for the opportunity that I have had and my family have had to be in this country, while still really deeply relating to the consequences of our existence here for the people who are here first, the First Nations peoples. So that's kind of our coming to be and coming to place in that introduction to Australia in the 1980s. And then I stumbled forward into the 1990s. So that's high school, trying to get a sense of who I am as a young African woman, wanting learning to become a woman in this country that often privileged and prized anything other than what I was becoming. And I can't change who I was becoming. That's my ancestry, that's my DNA, that's my lineage, and trying to understand how do I fit in this context. And again, I think having that sense of connection to what is it that I actually want to become educationally was always a really grounding thing for me to be able to say, okay, in spite of everything that's happening and some of those identity pulls and drives and a sense of invisibility, what is it that I actually want to be, and what do I want to become, and what are the pathways that I can take to achieve that outcome? And so it was always back to the books for me. So I really love learning, and I think Nat, coming full circle now to the job I am, you'll see why it's a repeated theme. Like, what can I learn? What can I pick up? What can I do? How do I help myself to get to where I'd like to be? I actually didn't go into medical school directly. I did art science first. So I did French, immunology, history, theology, a host of many and varied subjects before I went into postgraduate medicine in Sydney. So that transition, again, it was really great. Again, that journey of learning about different perspectives around how our societies are organized was really instructive as far as giving you that moment of reflection of who am I, how do other people view themselves in different contexts, and how do I maybe learn to fit in more into Australia, or also feel more comfortable standing out as well, because there's always that tension of fitting in versus standing out, sense of individual identity versus sort of group identity and group belonging. So I did medical school in Sydney, and that's where some of those threads of health equity start to come through again, because at that stage you're thinking about, why would you want to be a doctor? What is it that you can do as a doctor that you maybe couldn't do as a humanitarian lawyer? I say that because one of my cousins is a lawyer. She's a real high achiever. She's a professor at Harvard. So she's one of those, oh yeah, she went up to me again. I thought I was doing well. She's like, guess what? Just got a professorship at Harvard. I'm like, oh. So it's that, okay, what do I want to do? Why would I want to be a doctor? So the host of things you can do that are impactful. But for me, health, or the health connection journey, came from, I grew up in Zimbabwe, and anyone who's is Zimbabwean knows that for the most part, women had pretty much 3 or 4 jobs you could have. You were either going to be working in domestic services, you were a nurse, you were a teacher, or you were an administrator, or had an administrator type of job, sort of secretarial. Most of my family nursing, and phenomenally amazing nurses. So that was where I was getting those sort of signals around, this is a great career. You can be really impactful in your community. You can help yourself. You can help others. And I think that's where the early beginnings were. And then once you're in the health system, so I was training in New South Wales, you're getting a sense of the differences between what access people get in the country versus in the city, even suburbs difference, the difference in what you can get access to and the impact that has on the outcomes for patients. And then thinking back to the experiences that I'd had in Zimbabwe, observing the same thing through the HIV pandemic, and the difference between people who had family overseas and those who didn't, who got access to early treatment, those who didn't, those who lived, those who died. And what that does to you as an individual, to know that there's nothing mystical about it. It is fundamentally about how we structure our health systems to either support people or to just allow them to fail on a massive scale, on an epic scale. And then the same thing again with COVID. So my journey to infectious diseases as a specialty is probably, again, walking those threads of, what do I care about, what has impacted me as an individual, and where do I feel like I could have greatest impact. So that's kind of that, getting to the infectious diseases specialty bit. And then everything after that is the short version is I want to say 2 years, but in reality, it's about every 6 months. Every 6 months, I kind of get a bee in my bonnet about something I'd like to try and figure out or learn. And that usually translates into, I sign up for another course. The most recent I want to learn something was learning to be a Zumba instructor. So I did the course, and I can teach Zumba, but I haven't yet had the courage to actually do a proper class. So if the spirit takes me, maybe I'm going to do it. But I've got some other things that are kind of bubbling and brewing. But I'm really lucky to work in an organization that is completely about lifelong learning for specialists, and it suits me well, being able to learn, support other people to learn, and also work in a really educationally focused organization.
Oh, that was amazing. That was incredible. You have so much to share and so much to give, and that lifelong journey is something obviously you have embraced with a passion, and I love it. So thank you for sharing that. You touched a little bit on what you do. Could you tell us perhaps a little bit more about what you do and why is it important to you?
Yeah. So I have probably, I'd say, three main jobs. My substantive role, or my largest job, which takes up about 3.5 days a week, is the College of Physicians job. So in that capacity, I work across, I guess it's a broad portfolio. So I work in workforce planning, research, data planning. I work in philanthropy. So we have a research foundation that gives out grants to doctors, specialist doctors who are wanting to research particular areas of interest to them. And through that, we're trying to establish some new types of grants. So in sustainability in medicine, for example, which is, there's not a lot available for people who want to study that. Then there's the global health aspect, which has been a little bit challenging post COVID to reignite that and reinvigorate it. And then it's a lot of intersecting with other parts of our college. So the teams that do the training and exams and evaluations for doctors coming into the country, the teams that do the assessment of international graduates or international doctors coming into the country. There's the policy and advocacy wing as well. So there's just a lot of different things that our organisation does, where I'm one of two doctors within the management team. So it's just that it's a bit of a translator / ambassadorial role that's also got work attached to it. So it's a really fun and exciting job to have. The other parts of my job are clinical. So I still do a clinic in co-health, in refugee and migrant health. And I'm at hospital, so Royal Melbourne Hospital, primarily doing hospital in the home, which is another really fascinating space that I never imagined that as part of my job, I get to go to people's houses to just give them care or treat them in their homes. It's a rare thing, but hopefully something that will become more commonplace, because I don't think hospitals are designed in the modern era, are designed to actually support full well-being or holistic well-being, whereas people's homes can be that place. But we've just got to figure out how to make it work. So that's my working week can look very many different ways depending on what crops up in each of those work buckets.
I love well-being in the home. It's like, I feel it makes you more intentional. It makes you more intentional if you're in that environment and you're getting help within that environment. I love it. Kudzai is such a great advocate for inclusion and equity. And I would love to know what role you see inclusion and equity playing in the medical profession and wider health and well-being landscape.
Yeah. I mean, probably the most foundational reflection of why it matters for people to be included in the way systems are designed in healthcare is the space of research and technology. So if I take COVID as an example, what we saw at the beginning there were people rolling out mask test kits for a male body. And what that meant was there were many instances where women were turning up for work and finding masks and gowns that were many sizes too large for them, because the default setting was, hey, if we've got to do a disaster crisis response, let's pump out things that are big and kind of will fit people. Man, if you go, for example, if you go to the supermarket and you buy something and you look at the energy ratings or the energy plate or the calories or the inputs, that standard daily intake is the standard daily intake of a 70 kilogram man. Nobody tells you that, but that's where there are all these things that are embedded in the way that we view the world and the way we view what is normal and what is healthy, that become so invisible to us that we even stop to guess. Because 8,000 kilojoules in a day for an athlete would be vastly insufficient, but it's the default settings that we set. Those same default settings, if you then put them into a hospital or a healthcare setting and somebody comes in with pain and Nobody really has researched how pain or particular types of pain, whether it's, ovarian pain or uterine pain, how it presents and how horrible it can feel. That then means that that frame of reference that we are all using to gauge whether or not that person is category one triage needs to be seen immediately versus, you can sit in the waiting room for 5 hours writhing in pain because we're kind of not familiar with this. It's not part of our frame of reference. It it results in death. It results in either permanent injury, results in death, or suboptimal experiences that mean that those patients or those people are even less likely to want to come back for care in the future. I have relatives who've recently had really shocking experiences in our local Melbourne hospitals where they've turned up and people have made statements that very clearly indicate that the person has not even thought through the fact that they haven't included a frame of reference that would relate to dark skin. So saying things like, I can't see any redness, so it must be okay. How would you perceive of redness in somebody who has very dark skin? But that is said completely off the cuff by somebody who hasn't even contended with the fact they actually haven't thought through, well, I'm going to have to rethink that because if I'm looking for bright red, I'm not going to see that unless the person is literally bleeding onto the floor, which is a very obvious sign that things are not going well. So inclusion for me is the first barrier or the first hurdle that you need to meet before we can see each other vaguely as equals. And I like to work in spaces where that power dynamic is not so vertically oriented, because when it is, it's very difficult for a person who is in a time of need or stress or pain or ill health to really volunteer the full spectrum of what it is they're experiencing. And for me as a clinician to hear that, make sense of it, and then we come up with a plan together, because that's the goal. We come up with a plan. Yes, I've got my technical expertise, but again, and I think this plays out really nicely in hospital and the home, you have to take it home with you and you actually have to make it work. I can only do so much. And it's a tiny, tiny proportion of people in a hospital setting where they've actually lost all control. That's intensive care, right? The decisions are no longer mine, but the vast majority of people inhabit spaces, thankfully, where there is a space for dialogue, me understanding you, you understanding me, feeling included in that dialogue so that we get to an outcome that is acceptable and a quality one where I know my biases and I'm prepared to contend with them so that we can make a better plan for you.
It's excellent. It's just ask the patient, talk to the patient. I think one of the days where you just do what you're told and we know what's best for you, because that's a very, very narrow view, isn't it? So you've had such a successful career. Like I said, we're in awe of everything you've done. But what were some of the key obstacles that you've encountered along the way, and how did you overcome them? Because clearly you have.
Do you know what my tennis coach says? He says, Kudzai, who's your first opponent? And I go, I don't know. He said, it's you. It's always you. You are always your first opponent. And I think that is the thing, is that realization that a lot of the times you can get in your own way. And it's not because you're doing that by yourself. It's because you're reading cues from around you as to what's acceptable for you to aspire to, what is okay for you to ask for, what is okay for you to apply for, or invite yourself to be a part of. So the hurdles have often been personal ones that are embedded in that ecosystem of, I'm getting a lot of really negative cues about, I want to, for example, when I wanted to do the MBA, a colleague at work said, oh, are you sure you're up for that? That is not a normal response for somebody who has just volunteered to you that they would like to do something or to try and progress with something. And then, of course, you take that away, you make of it what you make of it, and then you have to deal with it. And sometimes that dealing with it can lead you on a positive of, a pathway of positive growth and that, I heard that you've got whatever's going on with you, but I'm going to, get on with it anyway. So there've always been hurdles, and a lot of them are born out of what sense you make of the messages the world is giving you, particularly in this country. What messages do you get about being a woman? What message do you get around being a Black woman? What message do you get around, somebody who is wanting to progress their career? What messages are you getting and what sense do you make of them? So there have been many, many hurdles. There have been, publications that I've tried to get published that are rejected. There are job applications that, you apply, you don't get them. But that's normal and that's okay. But it always comes back to what sense do you make of it? and what connections do you need to make, or what other feedback do you want to bring in or invite into your mind and your space, so that you can still feel like, yeah, stuff happens, but I can find ways around it, or I can decide actually that's not something I want to pursue anymore.
Making sense of the message. I think that's a really powerful one. I think there are a lot of words that I said to women in particular Black women, particularly around ambition
Yeah.
and not being. I always say there's an element of being given permission, or where permission is withdrawn, and when permission is withdrawn, it just means you need to fight a little bit harder.
Yeah.
That's hard.
Um,
So yeah.
Sometimes if permission is withdrawn, and this was a lesson actually that I learned. One of the jobs that you do when you're doing your specialist training is you have to do what's called consults, which is basically you'll get a call from another team in the hospital that says, hey, look, we've got someone with an infection problem. You have to go and give them advice on what's the right thing to do. And it's that learning that sense of autonomy and professional independence around, one day this is going to be my job. People are going to be asking me to give a better response or to provide advice. And I used to get so mad when I'd give a consult advice and people would do the opposite thing, or they'd change it, and I'd go back to my head of unit and I'd be like, I told them 2 days ago that I wanted them to do these things and they didn't do them. And one of my supervisors said, well, what about this? The fact that they haven't done what you wanted is also an opportunity for you to see what happens. Maybe view it that way. And sometimes that's the way I take it. When someone says no to me, it's actually an opportunity to pause and go, okay, well, what could happen? What other alternatives are there that maybe I haven't actually thought about? And there have been times when, rather than fighting harder for a thing that I thought I want, that moment of pause is enough to go, oh, whoa, there's actually a better option. So thanks for putting that little roadblock there, because it was just enough for me to get out of my own loop of I've got to just have it the way I want it, and actually go, there's something that's way better.
That's a growth mindset. Wow. So what motivates, like you've gone through all of these things and where you are now, as Sandra said, it's not easy to get to. What motivates you to keep pushing forward and to keep working for what you know is right for you and right for the people that you want to serve?
You get one shot. As far to the best of my knowledge, you get one shot at life, or at least this particular life, I get one shot. Even though that's true, or you can intellectualize it as much as you can, there are just some aspects of being alive that make you think, what am I actually here for? Like, why are we here? Why is the moon there? Why does the planet exist? Like, what is it all about? Does it matter? Does it not matter at all? And I think I've chosen a pathway that keeps you oriented around purpose. And that's my modus. That's what keeps me going, is that if you don't find anchor points in this world, it's very easy to just disappear or become very aimless and wondering. And that is the greatest challenge of life, is how do I kind of fight that sense of existential anxiety that is perpetuated by either comparison with other people or comparison with, other times or places in history where we're like, what if this was happening? Or what do I do? What's the right thing to do? And it's just that what keeps me going is a really strong sense of connection with purpose. Even if in some parallel universe, all of this is not really real, did I try and make it as meaningful as possible so that you can actually handle the reality of life is complicated, life is hard. But if I'm doing things where I feel like, even if it turns out to all have been an illusion, wow, it was a really good illusion and I kind of liked where it ended up. So it's a little bit of a kind of like a mind game you play with yourself, and then just turning it into things that feel as real as possible, where you feel like you did something that was good and of benefit. And it just helps to make life easier. Having goals, having purpose, having direction makes life easier, and hopefully ultimately makes it easier for all of us, in our care circle, in our bubble, in our community, to feel like they have a sense of connection with each other.
Before we
Amazing.
wrap up, I have one last question. What would be your advice to professional migrant women who are trying to do their best in Australia and try to follow a career path that they are passionate about and not a career path that is suited to them based on societal expectations?
What helps, I can say what helps me, and it may not help everyone else, is to be able to get to the point where you see yourself and that you're seeing yourself really clearly. Because there comes a point when you're surrounded, as I said, by cues from externally and others, where you start to actually see yourself in someone else's eyes. That is a very strange place to be, and a place where you can get led in many different directions and maybe give up on what it is that you actually see for yourself. So for me, it's that practice, it's a practice, a discipline of visioning, of seeing yourself very clearly for who you are, not what the person on the bus just said they saw of you, because that is not you. And you're the only one who actually has full view of your life, of your thoughts and your decisions. And remember to see yourself really clearly in that moment when you're challenged by ideas or assumptions that people make about you, is to remind yourself to see yourself. So when I see myself again as a Zimbabwean Australian. I see myself as a mum. I see myself as a wife. I see myself as a doctor. I see myself as my grandmother's granddaughter. I see myself as my mother's daughter. I see myself as my auntie's niece. I see myself as a good friend. And it's just important to be really clear and to just take those moments to reflect and to see yourself clearly, because from that vantage point, it's a lot easier to progress in the direction that you want, because you're not wasting your energy trying to sort of deal with other people's visions, because they're not yours. You can't control them, but you should really own your own vision and see yourself as clearly as possible to help you get to where you want to be, where you deserve to be, and where you're eminently capable of getting.
Oh, I love that. I wish I'd had that advice about 30 years ago.
It's never too late, Sandra.
No,
It is never too
I'm
late.
seeing that. Absolutely. And it's just that overcoming other people's limited expectations.
Yeah.
And you mentioned bias earlier, and they might not be biased against you, the person who said, "Are you sure you're up for that?" It
Yeah.
might be like, "Oh, I don't think I could do that." So they're putting their own self-doubt on you sometimes as well, and you don't have to take it. You can just go, "Off, yes, I am up for that." So that's amazing.
You
Thank
know,
you.
my grandma would always say, "Abakuzive," which is basically like they don't know you. When they say people say things that they don't know you, and I'm like, yeah, you don't know me. You know, my grandmother said they don't know me, and that's okay. I know me. So, go get it.
Yeah. Oh, I love that. That brought so many memories.
Yeah, it's you.
Like they don't know you.
Yeah.
Well, because I thank you so much for joining Sandra and I on Empowered Voices Amplified. There are so many. I feel this episode is so packed with a lot of nuggets. I've taken a lot away from this. I particularly like what you shared about, self awareness. Just know yourself, and then go for what you want to go for, because you're the only person that can know themselves, and other people can project what they are feeling, as Sandra has just said, and say it back to you. But because you know who you are, you keep going and you keep thriving for what you want. This has been phenomenal, and I've learned a lot. Thank you again for joining us. Any last words? Any last words or piece or advice that you have for our listeners?
No, other than know yourself, something that I'm learning to do better is to also ask for what you need from people, to really ask for what you need, because life wasn't meant to be done alone at the end of the day. And as much as we pride that voyage of the solo hero and the champion, life was not meant to be done alone. So really work as much as you can to cultivate that sense of who do I need, what do I need, and get comfortable saying that, because it can be a difficult thing, particularly for women or people who feel somehow isolated or lacking in belonging and connection to a new society, to get to that point of asking. And also I think the harder thing about the asking is often people can receive that as a request that comes from a place of deficit. Whereas I say it's actually a request that comes from a place of strength, which is I know what I need. And even though sometimes it will feel as though it's received as a message of deficit, please guard yourself against that and know that the reason you're asking is because you're strong enough to know what you need, and you're strong enough to ask for it. And however it's received is not your business. Just do it.
Ask for help.
Yeah.
Amazing.
Well, thank you. Thank you again for joining Sandra and I on today's episode of Empowered Voices Amplified. And thank you to our listeners for tuning in. If you have any questions or would like to know more about the work that Kudzai does, I always feel like I should say Dr. Kudzai because you've worked hard for it, about the work that you do. Where can they find you? Where can people find and connect with you?
I'm on LinkedIn. That's pretty much it for the socials. I have a short attention span, but LinkedIn I can handle.
You have a very busy life. That's probably all you can fit in.
So you may connect with her on LinkedIn. And if you have any questions at all regarding this episode, feel free to send us an email or a message and we will respond to you. Thank you again for tuning in to another episode of Empowered Voices Amplified. We will see you soon.